Hello, my name is Ben Shaberman. I'm Vice President of Science Communications at the Foundation Fighting Blindness, and glad you could join me for this webinar on retinal degenerative diseases. I'll be covering the inherited retinal diseases. Briefly, I'll cover AMD, and I'll present some ways you can offer a path forward for your patients affected by these conditions. So, inherited retinal diseases affect about 200,000 people in the US collectively, and that extrapolates to more than 4 million people that are affected worldwide. Most people with an inherited retinal disease are diagnosed sometime in childhood, and these conditions are progressive. Also, inherited retinal diseases are most always monogenic. And what I mean by that is for every person affected, there is one mutated gene that's causing their disease. The challenge is that there are more than 280 genes, each of which, when mutated, could be the culprit. And that really underscores the need for genetic testing. So while these conditions are challenging, and obviously they cause quite a bit of vision loss ultimately, the retina is an excellent therapeutic target because it's small, it's relatively accessible, and we have two of them. So you can study one, a potential therapy, let's say in a clinical trial, and use the other eye, the other retina, as a control. So to start off, I wanted to talk about retinitis pigmentosa. It affects somewhere in the neighborhood of 100,000 people in the US. Typically, RP causes peripheral and night vision loss at first, and that's because most of the mutations that cause RP affect rods first. But cones are often affected as well, especially later in the disease. RP is usually diagnosed in childhood or adolescence. It is progressive, and it can vary quite a bit in terms of severity. Some people are affected pretty significantly early on in life. Other people may maintain useful vision for much of their lifetime. Another challenging aspect of RP is there are somewhere in the neighborhood of 80 genes, each of which, when mutated, can cause the condition. There are three different inheritance patterns for RP. Recessive is when parents are unaffected carriers and their children each have a 1 in 4 chance of getting both mutated copies of the gene from their parents, and are therefore affected. RP can be inherited dominantly. That's when one parent is affected and their child has a 50% chance of getting that mutated copy. Or the condition can be X-linked, where the mutation is on the X chromosome. And what we typically see is that females are unaffected. They're carriers. They can be carriers. Or if they are affected, it's mild. And they have a 50% chance of passing on that mutated X to their sons. And if the sons do get that mutated X, they're definitely affected. And X-linked diseases tend to be pretty significant for males. And about 100,000 people, again, in the US are affected by RP. So on this slide, I have a couple of fundus photos. These are probably pretty familiar to you. On the left is a normal fundus. You have that nice, healthy, bright orange glow. On the right, it's pretty obvious that this retina is in a difficult situation with all that degeneration, the black area in the periphery where cell loss has occurred. And this is pretty typical in a more advanced form of RP. So typically what happens in people with RP is their vision is constricted over time. And that's what the simulation on the bottom of this slide is showing. And eventually, usually in adulthood, middle age, vision is constricted to the point where it's like looking through a tissue roll or a straw. But that small area of remaining vision can eventually close up in some cases. So next, I wanted to talk about Stargardt disease, which is the leading cause of inherited macular degeneration. Usually, it begins in childhood, and similarly, or similar to dry AMD, Stargardt disease is characterized by the accumulation of toxins underneath the retina. And these toxins are byproducts of vitamin A processing that's critical to the visual cycle in the retina. But Stargardt disease patients do not clear those toxins. They accumulate, and that's, again, what causes the problem. Stargardt disease, in a vast majority of cases, is inherited recessively. And Stargardt disease, as a form of macular degeneration, causes central vision loss. Again, it typically is diagnosed early on in life, childhood, young adulthood, but it can vary in its progression rate and severity. And in some cases, people aren't diagnosed into their 40s or even older, though those cases are relatively unusual. So about 30,000 people are affected by Stargardt disease in the US. And most people who are affected by Stargardt have mutations in the gene ABCA4. Again, on this slide, I have pictures of the fundus on the left, the normal fundus. The next two photos moving left to right are of retinas affected by Stargardt disease. The one in the middle, you can see that area of atrophy in the center and some of the yellow deposits surrounding that area. Those deposits are those toxins that I talked about earlier. They're called lipofuscin. And on the right, this fundus image, which is enhanced by autofluorescence, shows a pretty significant area of atrophy in the middle, and then some areas of newer degeneration that are fluorescent around that area of degeneration. And then on the bottom is a simulation of the central vision loss that someone with Stargardt disease might experience. So some other retinal diseases that affect patients include Usher syndrome, which is basically retinitis pigmentosa with hearing loss. Patients can also have balance problems. There are 12 genes, when mutated, can each cause Usher syndrome. Another relatively common IRD is choroideremia. Choroideremia affects multiple cell types in the retina, including the choroid, the vasculature, the RPE, which is the support system for photoreceptors, and then photoreceptors as well. Retinoschisis is a pretty challenging inherited retinal disease. It causes splitting of the retinal layers. Leber congenital amaurosis, or LCA, is really a family of conditions. And the common theme there is kids are born with severe vision loss or experience severe vision loss at a very young age. LCA is genetically very diverse. There are more than 24 genes, each of which, when mutated, can cause LCA. Achromatopsia affects cones. A common symptom, or really the hallmark symptom of achromatopsia, is what we call day blindness. People with this condition have really significant sensitivity to light. It's often painful to be in a lighted setting or a bright setting. These folks also have issues with visual acuity and color perception. And then last on this list are Best disease and cone rod dystrophy. These are different forms of inherited macular degeneration causing central vision loss. So I'll briefly cover age-related macular degeneration because you're likely pretty familiar with it. Unlike the inherited retinal diseases, AMD is pretty common. It's the leading cause of blindness in people 55 and older. In developed countries, about 10 to 11 million folks in the US are affected. That extrapolates to 150 to 170 million around the world. The leading risk factors for AMD include aging and smoking. Unfortunately, we can't do too much about aging. We can exercise and eat a healthy diet. That's important. But not smoking is really one of the best ways to prevent AMD. There are genetic risk factors. There are variations in at least 12 genes that can increase or decrease AMD risk. But just because somebody has certain risk factors doesn't mean they'll get the condition. As you likely know, AMD starts with the dry form. It's the buildup of deposits underneath the retina known as drusen. Dry AMD can migrate into what we call geographic atrophy, which leads to pretty significant central vision loss. But also people with dry AMD can develop leaky blood vessels underneath the retina, choroidal neovascularization. This causes pretty significant vision loss and fairly quickly. But the good news, as you likely know, is there are many therapies available that have been approved by regulators to mitigate that blood vessel growth. So on this slide, I have a couple fundus photos that show what AMD looks like, how it affects the retina. On the left is dry AMD. You can see those yellow flecks toward the center of the retina, toward the macular region, those deposits that can ultimately lead to atrophy. On the right, that sort of C-shaped blob near the center of the retina, just off to the left of the center, is that choroidal neovascularization, those leaky blood vessels. So the good news is there are things you can do to help your IRD patients and your AMD patients. For your IRD patients, it's important that they are genetically tested because it's ultimately the genetic diagnosis that can confirm the clinical diagnosis. And fortunately, there are no-cost genetic testing programs, including one offered by the Foundation Fighting Blindness. It's important if your patient has significant vision loss that either you provide low vision services or provide them access to or referral to someone who can provide low vision services. We encourage you to connect your patient with the Foundation Fighting Blindness. They can go to the Foundation's website, fightingblindness.org. There's a nice webpage for newly diagnosed patients. That's at fightingblindness.org/newly-diagnosed. And we also have a lot of resources like our chapter network, information on diseases and research, and other ways to connect with the foundation. We strongly encourage you to recommend participation in our My Retina Tracker patient registry. It's free, it's secure. We do not share personal information to researchers or other people using the registry, but by having your patient in the registry, they can learn about clinical trials and clinical research projects that might apply to them. And in some cases, it may be helpful to refer the patient on to a retinal specialist who understands IRDs well, an expert in IRDs, if you feel that additional expertise is needed for your patient and moving them forward. And of course, it's important to communicate optimism and hope for the future. And a lot of these resources on this page can help you do that. But also, one thing that we found at the foundation that gives people a lot of hope is the fact that there are more than 40 clinical trials underway for emerging therapies for inherited retinal diseases. People are very excited to learn about those trials. You can learn more about those on our website or at clinicaltrials.gov. And I hope you'll come back for our next webinar, which is on genetic testing for IRD patients. I appreciate your time. If you have follow-up questions, I encourage you to reach out to my colleague, Michelle Glaze. She is our lead for professional outreach, the director of professional outreach, and her contact information is at the bottom of the slide. And thanks again for joining the webinar.